Hi, my name is Govoni. I'm the head of the Health Research Partnership and the head of the Joint Clinical Research Office. So I'm just going to briefly tell you about this office, which was established in 2019 by the medical school, recognizing that the need for expertise in setting up clinical research, in supporting the local researchers applying for healthcare projects. So we like to define it as a one-stop shop for health and social care research. We work closely with Sussex University Brighton and the two trusts, so these are our foundation partners and the medical school. So we are a single shared resource of advice and support across the clinical areas. And it's now, we went through a period of piloting this office, and it was recognized last year that it was needed, so it's now part of the HRP infrastructure. So what do? Very briefly, we provide early research management support, pretty much what Wendy was saying about a clinical trial. If it is a clinical trial, it's going to go through the CTU. If it isn't, but it's another kind of research in health and care, we can support all the different steps from providing expertise really for researchers involving, sorry about the acronyms, principal investigator or chief investigator employed by one of the partners. It needs to be involved in one of the trusts, and it needs to be sponsored by them. Again, just to say, we can sit in the middle of all of this relationship between the researchers, the funder, the clinical trial units, the sponsorship. All of this different conversation that the research needs to have can basically facilitate and support. We are a team of 5, we're going to be 6 in January. So we're growing. We are there to guide and support the researchers, to streamline the processes, and ultimately to improve the research quality. We have been dealing with about 100 applications per year, and we're getting busier and busier for sure. We have supported the partners to reach over 34 million in grants since the beginning, and with University of Sussex being our largest partner. Again, another message slide to say this is all the different bits of expertise that we can provide. The team is really good at providing advice. We've seen a lot of applications, so if somebody is not sure about, do we need support, we can also signpost you from the beginning. We can support in your relationship with any NHS capability and feasibility assessment. We can provide, once the study has been awarded, we can provide support for the different steps. One bit of partnership working that I wanted to talk about is the pre-sponsorship review panel. So we know that any research that needs to be, that we undertake in relation with the Health Research Authority needs to have a sponsor, so an organization that will take responsibility for it. And there is a sponsorship application that the researcher needs to do, and after that there is an application to the Health Research Authority. All these different bits have tons of paperwork and different steps to be going through. So we have set up this pre-sponsorship review panel, which is an additional step, yes, but it also helped a lot refining the application, so they were already much more higher quality when they went through the steps, and taking away a lot of work from the researchers. And we have over 60 members, probably more at the moment. So these are in-kind support from all the partners. These include methodologists, statisticians, clinicians, healthcare professionals, helping us reviewing the application before they need to go through these steps. So it's also it's very good for researchers going through this, but it's also very good for the people on the panel because they get to see all these applications. So we definitely recommend you to come and get in touch with us if you want to help us in this. The next step, so as part of the HRP, I guess we have been reviewing our infrastructure and resources, and we've been trying to identify the gaps and areas for expansions, and we would like to build a culture of continuous improvement and collaboration. We know there is considerable scope to broaden our range of work to support the HRP objectives. We would like to make sure that we integrate all the different key infrastructures, so we're really talking to each other, we're really connected. We would like to educate the researchers better about the requirements of the NHS, so improve advice, signposting and support for PCI work. That is a really key part of it. We would like to improve support for social care research. I think we are relatively good at clinical research at the moment. Social care, I think we can improve the support that we give. And supporting healthcare innovation activity as well, which we know the UHSX especially has been focusing on developing more. We would like to provide also comprehensive support across departments, pre and post award. And this is our contact details if you want to get in touch.